I'm Ed Bertrum. I am a neurologist at the University of Virginia, but I've been working for a number of years now with the International League Against Epilepsy. It was founded about almost 110 years ago now in Budapest, Hungary, and it's a group of professionals who are primarily dedicated to understanding and finding better treatments for epilepsy.
So a group was recently started, a new task force called, which is a Young Epilepsy Support Group, part of International League Against Epilepsy. Could you tell us more about that?
So this Young Epilepsy section for the ILAE has been developed to encourage people starting off their careers in neurology and epilepsy to get more engaged with it. One of the things that is always difficult for someone just starting off is finding a place, finding a home in an organization, and helping to encourage things that are real interest to them. So the decision was made a few years ago to create this group, which is largely self-directed, but the hope is, and the plan is, to give our young colleagues a greater voice, and also to help us know what's important for them, what their needs are for their professional development.
And why should young epileptologists and nurses join International League Against Epilepsy?
Because that's where the league is where things are happening. It's a place where people from around the world who are involved with treatment of epilepsy come together. They can discuss the problems, they can learn from one another, and also for just general professional education and development. There's a lot of material presented at these meetings which can be of very great value to them.
And how can young epileptologists get involved with the task force? Is there a website that they can look up?
There's a section on the league website about it, but they also have its own communications operation through Slack. But the first place to start is with the ILAE.org, where there's a section on the website about YES, and then how to join up and how to get involved with it.
Ed, can you tell me about your background as a neurologist in epilepsy? Just a brief background.
Well, when I started in neurology, I didn't know a lot about epilepsy, and when I was training at the University of Virginia, there was a very senior, well-known epileptologist, Fred Dreyfus, and he had one of the first epilepsy units in the U.S. It's very common in Europe, but it's much less common in the U.S. And when I started working there, doing my regular rotations there was just something about epilepsy and the issues that people with epilepsy face that just somehow struck a chord. And so I got interested in it, and the more I got involved in looking at the many factors that are involved in the treatment of epilepsy, the people with epilepsy, the issues they face, it just sort of was gradually pulled me more and more into it. And as far as my research goes, the kind of questions about the brain that you want to answer in epilepsy, there are also things that I'm interested in just about how the brain works. So it's been, for me, on the research side, it's been just an area that really has a lot of fascination for me. But on the clinical side, you really sort of have to work with the whole person.
Yeah.
It's just not a seizure count, your seizure better, but it's how is your disease affecting you. And I've really been very gratified by the interaction I have with my patients.
That's really great. And tell me lastly, about Epilepsy Awareness Day. Why are you involved personally, and what do you think of it? And why do you think, why should young epileptologists and experts in epilepsy come and attend this event?
I think for us, for the professional, there are two parts to that question. One is people do have questions about it, and they would like to ask a professional. So we're here to answer questions that people may have.
Yeah.
But the other piece, which I think we want to start to emphasize more in coming epilepsy awareness sessions, is to hear more from the patients. One of the things that one of the big issues is we have a certain perspective of epilepsy, but there are a lot of things the patients tell us about the issues they're facing, what the greatest difficulties they are in getting their disease addressed and their needs addressed. And so they're telling us what the big issues for them are. I think will help us direct and develop the care better. So I think probably the second and probably most important issue really is to hear from people with epilepsy, from their families, so that we might be able to then address those needs better.
That's great. And so thank you for talking to us. So finally, once again, where can viewers find out more information about the International League Against Epilepsy?
The best place to start is to go to our website, www.ilae.org. And there's actually sections there for patients and treatment as well. So there's a lot of information to be had.
So Edward, thank you for talking to us.
Thank you very much, Sam.
Have a good rest of the day.
You too. Thanks, Sam.